How often do we get stirred by these images? How often do we feel helpless, wanting to reach out to these unfortunate souls, but can't take the first step? How often has the wail of a suffering soul pierced your heart? And yet, there are human beings who have made a difference in the lives of these unfortunate souls, have worked selflessly to empower a community and nurture individuals sensitive towards the society. This is Srimati Malini Kishore Sanghvi Hospital and Educational Complex, a unique endeavor by the philanthropic inspiration of Shri Kishore Bhai Sanghvi and the Dr. M.L. Dhavle Memorial Homeopathic Institute. The institute has been set up with the specific objective of providing homeopathic and allied medical treatment, set up a world-class educational and research facility in homeopathy, and create a socially and economically strong, self-reliant society. The institute is located near Karjan, just opposite the holy Sumeru Tirth in Gujarat. But how did this vast complex, spread over 11 acres of land, take form here?
I do not belong to this place. I originate from Saurashtra. My Karma Bhumi is Bombay, and it appears that this seems to be my Dharma Bhumi. I realize there are 99 villages around, and it is under poverty line. People are exploited. I was inspired to start clinical facilities initially with diagnosis center, and subsequently, after an experience of 2.5 years, decided to build a hospital complex. This was possible because I had some connection with MLD Dhavle group, with whom I used to go to the forest to treat Adivasis about 20 years ago. And I knew their method of working, that they always believe in helping downtrodden.
The MLD Institute is a premier organization renowned for successfully setting up and professionally managing homeopathic hospitals and colleges. The institute has reached inaccessible areas of the country and provided medical treatment to the needy. For this organization, healthcare is not limited to the wards of the hospitals, but goes much beyond, right to the grassroots level. This group of doctors and social workers get actively involved in the communities, educate them, spread awareness, and ultimately empower them so that they emerge stronger to lead a better and healthy life. This model has been replicated successfully in Palghar, near Mumbai, Pune, and Bangalore. The MLD Institute took up the responsibility to set up the new project at Karjan. The ideals of late Dr. Dhavle, a visionary in the field of homeopathy, are benefiting the masses today.
Dr. Dhavle was a great clinician and a great teacher, and he taught us that homeopathy has a role in going to the masses and treating patients in the most cost-effective way. In fact, homeopathy is one of the most cost-effective medical science existent today. He gave us a training system, and he told us that try to reach out so that homeopathy becomes the mainstream, and do it in a way which is adhering to highest standards of excellence. And that is why the institute has the motto of Yoga Karmasu Kaushalam. Perfection in action is yoga.
डॉक्टर एम.एल. धवले हमेशा हमें ये कहा करते थे, तुम्हें एक ऐसा आदमी मिलेगा जो दीन दुखियों का दुख दर्द समझ सकेगा उसके दिल में उनके लिए प्यार होगा, जिसमें समता, सरलता, निष्काम भावना होगी, विनम्रता होगी। किशोर भाई ऐसे ही हमें मिले जैसे हमारे गुरु ने कहा था। उन्होंने इस सुमेरु की पवित्र पावन भूमि में जिस तरह से एक मंदिर तीर्थ स्थान बनाया, उसी तरह से उन्होंने इस पवित्र पावन भूमि में हॉस्पिटल बना के, कॉलेज बना करके, रिसर्च सेंटर बना करके जो ज्ञान की गंगा बहाई है, इससे दुख दर्दियों को सेवा मिलेगी, विद्यार्थियों को ज्ञान मिलेगा।
The MKS Hospital is a model community-based healthcare institute. It is a 50-bed multi-specialty secondary care hospital equipped with the latest pathology laboratory, a radiology department and an ambulance. There is a full-fledged operation theatre too. Emphasis is on providing homeopathic treatment, but allopathic facility is also available.
Patient come first in the system. We are a team of dedicated homeopaths working closely with allopath. We are getting patients from the 40 to 60 kilometers area who are extremely poor. So this hospital is a boon for those patients.
ડૉક્ટરે બહુ સારા છે અને દવાખાનું બહુ ટોપ છે અને અભણ માટે બહુ સારું છે. ડૉક્ટર સમજાવીને બધી દવા આપે છે અને ફી ઓછી છે હાવ, એટલે ગરીબ માટે બહુ સારું છે.
The complex is a seat of learning for those who wish to take up homeopathy as a career. This homeopathic college will emerge as a benchmark institute for others to follow. Right from inception, the students would have access to the latest teaching aids with competent teachers. Qualifying as a doctor would be just one criteria here. The real challenge for the institute is to nurture a humane doctor, sensitive to the plight of the poor suffering masses, ready to discharge his duties with compassion and with the highest level of professional expertise.
We want to build up an education system where teachers are primarily physicians, because translation of their experience into the teaching is one of the core value of our institute. We believe that the philosophy and practice should go side by side. Ours is a patient-centered education where integration of all the medical subjects is being done. At the same time, we want our teachers to be sensitive to the community so that in turn they produce the students who are sensitive to the community.
The MKS Medical Complex believes in reaching out to those who cannot reach them. The dedicated team of doctors have traveled to remote areas, sometimes just to treat a single patient. It works closely with the Department of Social Work of the MS University to conduct surveys and form village self-help groups. Creating awareness, helping the poorest of the poor, and supporting enterprising men and women has created wonders, individually and collectively.
એને છે વિધવા, એમની જમીન વેચાણ થઈ જાય એટલે પછી અમે જોઈન થઈ એટલે અમારા મંડળમાં સભ્ય હતા એ બે, એટલે અમે મીટિંગ કરી ભેગી અને મીટિંગ કર્યા પછી એ બેનનો પછી અમે બધા સહકાર આલ્યો અને એવી રીતે અમે આ બેનનો જમીનનો નિકાલો આણ્યો.
In the villages, we have seen that women are exploited. We have created self-help groups, and the success of that group has really motivated us. And now we feel that the next step is literacy. We are working towards literacy so that they are not exploited, they become self-reliant. Another area where we are striving hard and working is in the de-addiction area. We have been fairly successful with the alcohol abuse. Our villages should be extended. Cities and the urban and the rural divide should decrease.
અત્યારે હું જુદી દુનિયામાં છું અને આજથી 2 વર્ષ પહેલાં હું કોઈક અલગ દુનિયામાં હતો. હું એક શરાબી માણસ હતો. મને પોતાને એ લોકોએ સામાન્ય ટકોર કરી, એટલે એ ટકોર મને ઘણી બધી અસર કરી ગઈ અને એમને હોમિયોપેથિક દવા પણ સાથે આપી. એટલે મારી વર્ષોની આદત જે શરાબની હતી, એ શરાબની આદત મેં મનથી પણ નક્કી કરી અને દવાએ પણ તાકાત આપી. આ બંનેથી હું આ શરાબની દુનિયામાંથી અલગ પડ્યો.
We all know how costly medical treatment is today, especially for the rural people where medical treatment is inaccessible. We are committed in building the character of a physician who is sensitive to suffering of people who are staying in village. They are unable to reach up to us. We must reach up to them. We want a physician who is dedicated and committed to give these services. As we know, healthy village is a healthy nation.
With a philanthropic gesture of Shri Kishore Sanghvi and the dedicated efforts of the MLT Institute, the MKS Medical and Educational Complex has taken form. Still, a lot more needs to be done to really translate our vision into reality.
When we initiated the college project, Kishore Bhai told us one thing: we must have a top-class infrastructure. And this indeed has been our endeavor. We have been rigorous in selecting the right people, and we now have a team of highly skilled professionals and dedicated people like engineers, architects, and designers.
The large piece of land that we still wish to go on to develop will go on to create a college, a residential complex for the staff and the students, as well as the auditorium. To us as an institute, this is one of the ways in which a community-based healthcare service can be provided. The institute strives for excellence and will go on to produce physicians and quality care for the patients who come, which will be nothing but excellent.
Our family ideals have been to give back to the society what society has given us. We have been quite fortunate to get the right people at the right time, and with the blessings of Vasupujya Dada Swami, we have able to achieve part of our dreams. This is just the beginning. Lots needs to be done. This is a drop in the ocean.
We had a vision and we pursued it with passion and compassion. Gauravam prapyate danat, natu vitasya sanchayat, sthiti ruchai payodanam, payodhinam adha sthiti. Greatness is achieved through giving and not by accumulating wealth. Clouds which give water are always up above, while the seas which store water are always below them. We are confident that there are human beings like the clouds above who will join hands for this noble cause. For the yeoman service rendered in the lap of the holy Sumeru Tirth is the ultimate service to the society.